Nick Ferrari at breakfast. Call 0345 6060 973.
9 minutes before 8 is the time. Now, if I were to ask you, what does tomorrow, the anniversary of? Many of you might say, well, it was the day the music died, because unfortunately it marks the day that John Lennon was fatally shot in New York. But it has a far more significant point in the conversations that we're having about healthcare, because it will mark two years since this country became the first to vaccinate its public against COVID-19. And writing in one of the newspapers today, Health Secretary Steve Barclay says, quotes, "If we've learned anything from that historic effort, it's that we bring the right people together, we can achieve great things." And I imagine to explain other great things that are about to happen, including an elective recovery task force, the Health Secretary joins me now. Good to have you on. What exactly is it you're announcing, and how will it aid my listeners? Good morning to you.
Yeah, so what we're announcing today is a further 19 community diagnostic centres. How it will help your listeners is an extra 1 million of the tests, the scans, the key treatments that they need as part of us clearing that pandemic backlog. So we've already got 91 community diagnostic centres. We've got an extra 19 today. But also what we're doing is we're working with the best people within the NHS, making the most of the independent sector, where there's additional capacity to do more treatment so that money follows the patient, and really driving addressing the variation in performance. So with too much variation across the NHS, so making sure that we get all areas adopting the best practice and get the productivity level much higher with too much variation in what we're seeing at the moment.
Have you and your colleagues set yourself a goal? That is to say, you want to see the waiting times cut by 20% within 12 months, or whatever the figures might be, Secretary of State?
Yeah, completely. So first week, we've hit the first milestone on that, Nick, over the summer, which was the 2-year waits, getting those addressed. The next big one is the 78-week waits, which is April. And part of the discussion today is just to get the urgency on that. So a key part of that is the diagnostic centres. It's also about having new surgical hubs, which are more resilient. So what often happens in hospitals is if there are winter pressures, it's often the operations, the electives that get cancelled because the beds come under pressure. So we're having the surgical hubs, the cold sites that are more resilient to those pressures, and really focusing from the Prime Minister across the whole of government on how we get best practice into clearing that pandemic backlog in terms of many of your listeners that are waiting for operations. How do we get that time down? And that's really what we're focused on, and the 19 diagnostic centres are a key part of that.
On to other matters. The NHS is not alone with the threatening clouds of industrial action, one of which, of course, is the paramedic or ambulance workers. When did you last hold negotiations with the relevant unions to try and sort out a deal with them?
Well, I last had a sort of roundtable with them a couple of weeks ago, but I've been very clear I'm open to discussions. Nick, I'd see them today, I'll see them tomorrow. I think there's a range of issues they raised with me, and I think there's a lot to be gained from us having discussions about that range of issues. But I do think for many of your listeners, a 19% pay rise is far more than they will be getting. It's about 3 times more than most people in the private sector are receiving. And what we're doing is we're prioritising our funding to the NHS. The Chancellor announced an extra £6.6 billion for health. He announced extra money for social care, because actually what goes on in our ambulances is often because we're not getting patients out of hospital who are fit to leave. So it's about social care as well as our health. We prioritise our funding on that, but what we want to do is get that into supporting patients and getting the waiting list down. And so we've accepted on pay the full recommendations of the independent pay review body. We've accepted those, Nick, in full. And also last year, when many other of your listeners had a pay freeze in the public sector, within the NHS we prioritised 3% for them. So we are prioritising the NHS, but we've got to be fair to your other listeners who face cost of living pressures. And, you know, if everyone in the public sector was to get inflation, that would cost us £28 billion. So we've got to have that balance across both the public and the private sector.
But many people say this fantastic army of men and women who form our paramedics and ambulance crew, some of the salaries are really bouncing on the bottom. Do you know what a paramedic starts at, his or her salary, Secretary of State?
Well, I thought you were going to ask me about nurses, because the first strike we're going to have on is nurses. A nursing starting salary is 25.5, and we're taking it up to 27.
What about a paramedic? Where does he or she start?
So it depends on what band they are. So I don't have that exact figure to me
they're at band 5,
to hand.
Secretary of State. So if they're at band 5, what would their salary be?
Well, a band 5 nurse starts at 25.5, so that was the figure I had in my head this morning coming in.
Okay, you're right. They start between £25,655 to £31,534. These are the paramedics we're talking about, of course, are all the front pages. We're very nervous about this ambulance strike that's looking like the 21st of December. If you're making that kind of money and you've been offered a well below inflationary pay rise, something like 4.75%, I read, why should you accept a pay cut?
Because firstly, I think we've got to look at it in the round. So the 25.5 starting salary is going up to 27 with the 5.5% increase for starting staff that we're putting in place. Secondly, actually, the take-home pay is usually on average 31,000 because it's common for people to do some overtime as well. We have a very generous pension scheme, so a fifth of the salary of a Band 5 goes in to the pension. That's 20% from taxpayer. We have a more generous sick pay and annual leave than would normally be the case for many of your viewers.
That doesn't help them at Sainsbury's or Asda, though, does it, respectfully?
Well, the trade unions... Well, you say it doesn't help them.
Well, it doesn't help them pay the bills, does it?
The trade unions say that it's extremely important as part of the wider package of remuneration. So the point I'm making is there's a package of remuneration. And if really what's at the heart of your question, Nick, is should we just be paying everyone in line with inflation, which seems to be what you're saying, well, that would come at a cost of £28 billion extra a year. And I think at a time when we face huge backlogs from the pandemic, it is important that we're investing in the community diagnostic centres. That's what we're prioritising today with the extra 19. It's important that we get more surgical hubs and we invest in our primary care and our ambulance trusts as well. So we're putting more money into the service. But in terms of pay, what the right level of pay is, we have an independent process that looks at that, and that's what the independent pay review bodies do. And the government has accepted its recommendations in full, and that's the right process to reach a decision on this.
I don't know if you've had time to see a photograph in the papers or any of your colleagues have been able to show it to you, but this is a former nurse called Keith Royals, who's aged 85, who is a terminal cancer patient, who fell sadly in his front garden and waited 7 hours on the ground for an ambulance, despite actually living opposite a hospital. What does that say about the provision of ambulances under the Conservatives?
Well, clearly, it's an issue of concern when people are waiting that long, and that's why we're prioritising health. It's why, in the autumn statement, we put, of the two areas in particular, we focused on extra spending. It was on health and on education. We're putting more money in it. We're recruiting more. So there's 3,000 more paramedics a year in training. Since 2010, there's actually a 40% increase in the number of paramedics compared.
Why is this
to
poor old
2010?
boy lying on the floor for 7 hours then, Secretary of State?
Because one of the biggest reasons for it is the number of people in hospitals who are fit to discharge, who should be leaving. That's actually been a challenge in social care, which is why we're prioritising getting more social care packages. And actually what we see in the ambulances is often the delays on ambulance handovers is because of patients not being able to leave hospital who should be leaving. So there's a number of issues. It's quite a complex matter. It's about demand management. It's about how the ambulance trusts have variation in terms of conveyance rates. It's what's happening in A&E. It's what's happening with delayed discharge, which in turn has an impact on social care. So there's a number of factors that are behind that. There's also variation within the NHS itself. 15 trusts are responsible for around half of ambulance handover delays. So we've also got teams looking at best practice within those trusts to really address where those outliers are.
Can you give us an update on a story at the front page of the Financial Times? Rishi Sunak pressed to speed up anti-strike legislation as industrial action surges. You'll be aware, Secretary of State, we're looking at the worst disruption. You'd have been at school, but the worst disruption since 1989. What legislation might be on the way?
Well, there's already some legislation in the House in terms of the rail workers. That's already been tabled. And, of course, we'll look at what further legislation may be required because we recognise just how essential these services are. But we're keen to work constructively with
So
the
this will
trade
become
unions.
a priority. Sorry to talk over you, sir, but this will become a priority, will it?
Well, all our contingencies, Nick, are kept under review. But I think the more important issue is that we work constructively with trade unions in terms of what services they will continue with the strikes. We're keen to engage with them in terms of the wider concerns that they've raised, and that's where the priority should be.
But I know this isn't your brief. But on the railways,
on it.
Secretary, I know this isn't your brief. There'll be no service at all from Christmas Eve through to the 27th of December. So how do you talk constructively in that area? Surely that is why we need some form of legislation that the newspaper is talking about.
Sure. And well, on that, Nick, we've already accepted that. That's why we've tabled in the House of Commons legislation in terms of the rail industry, because we do recognise that people need to be able to get to work, and that's an essential service. And that's something, if need be, we need to do through legislation. But we're continuing to engage with the trade unions. There's a range of issues that they've raised, and it's important that we continue that dialogue.
All right, lastly, you've talked about fiscal responsibility from the government. How are my listeners meant to take that when they hear that the Conservative peer, Baroness Mone, will face an inquiry while the National Crime Agency investigates a firm she set up which lobbied for receiving £29 million worth of funding, accompanied with her children, through your government? Where's the fiscal responsibility there? 29 million quid, handed out like sweets.
No. Well, firstly, it's right that if there's issues that are being raised, they're properly investigated, and that's why the House of Lords is investigating this. The Department is investigating it. If there's anything of a criminal nature,
what's your view of Baroness Mone? I mean, I haven't even mentioned the £122 million worth for medical gowns that failed the NHS quality inspections.
Well, I think I'd just remind you of the conversation you just had with the listener, Nick, when you were saying, look, I'd go to Switzerland, I'd go wherever, I'd do whatever it is to secure, in the context of Strep A, the drugs. You were saying, look, I will do anything if need be to get that. And that was the context that we faced with the pandemic. There was international competition, there was a global shortage. It's essential that we got the PPE to the front line. We got over 23 billion
I don't know if I'd spend
items,
122 million quid on gowns that were no damn good, respectively.
You were just saying, Nick. You were just saying you'd do whatever it was in order to
It does not include giving my aunt in Switzerland 122 million quid for gowns that can't be worn, Secretary of State.
Exactly, and if there's things that have been done that shouldn't have been done, that's properly investigated.
We've started listening to the show. We'd better be aware of this. And just finally, another story that we bring to is to finish our roundup of the front pages. Antibiotics, the provision of those to schools. There are concerns, you will be aware. Sadly, this story has taken a fatal turn. We're looking at now 9 young people who've lost their lives. There is a sense that we don't have enough drugs in the country, to refer that story that we mentioned earlier. What is the official stance on that, Secretary of State?
No, it's a really important, Nick, because I think a lot of parents are worried. They've seen the news on that. And I think, firstly, before coming on the media round this morning, I checked with the team last night on this. The manufacturers are under a duty to share with us if they do have concerns on supply. They've been clear that is not the case. Of course, when you get a surge of demand, sometimes you get pressure in particular GPs, and at that we have well-established processes around moving supplies of stock across wholesale depots, which is something that the suppliers do on a regular basis. So we have a dedicated team in the department that does this day in, day out, that has very regular contact with the suppliers. To date, they haven't said there's issues of concern. But what we're saying more widely to parents is that whilst this is something that naturally is in 1 in 5 children and actually manifests itself in many symptoms that are common at this time of year, colds, sore throats, we're just saying let's be extra vigilant. And I'd urge anyone with concerns, please do go to the NHS website. There's really clear guidance on what to look out for. And that's really the key message, is that complications are extremely rare, but it's important that we're vigilant at this time.
Good luck with the Elective Recovery Task Force unit. You can read more about that in today's Daily Express. Mr. Barclay has a comment piece there. Secretary of State for Health and Social Care, Stephen Barclay, thank you for your time. Appearing on LBC 4 minutes after 8. Lottie Morley has the news.
On your radio, on Global Player,